Hi, my name is Jennifer Cox, and I am a NICU nurse currently, but I have worked in the past as a pediatric nurse, and I am a certified pediatric nurse as well. I'm here to do a presentation on care coordination and why, as nurses, it's important. There are 4 core elements of care coordination, and the first is for us to allow access to all the needed healthcare services and providers. We want to make sure that our patients are able to access all of the healthcare services that they need, as well as all the specialists and primary care facilitators that they need. As nurses, you are the hub of that. You see what the patient is in need of, and you can advocate for those services and providers. The second element is to be collaborative and keep communication smooth and transitions through each provider's and care plans. So you want to make sure that the main care plan is addressing all of the patient's needs. You want to make sure that all of the people who are involved in the care of that patient and make sure that they have smooth communication between each member of the team. The third element is to focus on the whole needs of the patient and their families. You also need to take into account their cultural and belief systems. You need to make sure that they are treated with respect and dignity, and that you are making sure that you are covering the full spectrum of what they need in their health care. And the fourth is to provide information to the patients and families in a manner that they can understand. You need to meet them where they are and get them where they need to be. There are 3 categories of care coordination. The first is of a primary base, and this is for you. It works best for those with multiple health care issues and concerns. And the primary care team takes on the lead to coordinate the care between all the team members and the specialists. And this becomes very important as a nurse because you're going to be the one that speaks up for everyone involved. If there is an acute care issue, such as a heart attack or an emergent issue like a stroke or something that is requiring emergency care, this is where communication can break down, and it is the job of the acute care coordination person to step in and make sure that that does not happen. With the emphasis on attempting to handle something emergent and cover this, this is where you tend to have drops in communication. So it's important to take careful time to assure that communication between the caregivers is strong. It's also important to make sure that important attention is done to transitional and follow-up care with the PCP and specialists. You don't want to neglect follow-up care because you're focused on this emergency. In long-term care coordination, we're primarily concerned with handling rehabilitation needs and maximizing the quality of life, really focusing on those outcomes to make sure that they have the best possible one. It is important to maintain care with all the needed specialists and to facilitate communication between everyone involved. We also need to understand that we need to treat the patient as their own person. We need to be culturally sensitive and respect the person's backgrounds and beliefs, because a lot of times these backgrounds and beliefs do influence their healthcare decisions. And if we're focusing on autonomy and keeping them in control of their own decisions, we do have to take their backgrounds into consideration. We have to be respectful about it, non-judgmental, and as I stated before, we want to meet them where they are and get them where they need to be. You want to make sure that everything that you're doing with them, you're working as a team, because each team member has a piece of the puzzle, and if everyone works together, you have better outcomes. So when we talk about patient experience versus patient satisfaction, It's more that they are both a measure of healthcare quality. When we talk about experience, this is addressing the patient's actual experience of an illness or injury and how it relates to the healthcare that they're receiving, what they actually go through. When we talk about satisfaction, it's a measure of how happy they are with the healthcare that they receive. They're related, and a balance needs to be reached with patient experience being productive and a meeting of their needs, and the patient and families being satisfied with their care. You do occasionally run into a situation where there's an imbalance where the patient is not satisfied, but you are meeting their needs. It's their expectations that maybe need to be addressed. There are also times where they're satisfied, but maybe their needs aren't being met. So there's room for trying to reach a balance between the two. When we talk about coordinated care plans, we need to understand that these are necessary in today's society. You want to enhance the quality of care by streamlining communication between the two team members. This can be done through secured emails, respecting HIPAA laws, of course, but making sure that each team member has access to any results that they need or any tests that they need in order to make a decision, and you're not repeating these services. You want to enhance the quality of life by addressing as many of the possible patients' health needs. And you want to make sure that they have access to what they need to address those needs. When we talk about complex cases, we want to make sure that we are efficient and we take into account the nursing code of ethics. If you need reminding on what those are, we're all nurses here, so you should know that autonomy, beneficence, justice, and non-maleficence are all those four core ethics that we talk about. Autonomy, that they have a right to make decisions for themselves. Beneficence, that we are working for the good and the benefit of our patients. Justice, that everybody has access to what they need. And non-maleficence, that we do as little harm as possible to achieve the best possible outcomes. When we talk about the impact of healthcare policy on care coordination, I'm going to focus on two that seem most relevant. The Affordable Care Act was put into place to make sure that people were able to afford the care that they need. So it pushes for quality, patient-centered care that is affordable to individuals. This affects what we do because we need to make sure that whatever care is needed to make the best possible outcomes is within the reach of the patient to obtain. When we talk about the Impact Act, this is referring specifically to Medicare and Medicaid, where the legislation is pushing for organizations to have greater care coordination to drive costs down and improve experience and satisfaction. If you need an example, if you think about it, when you have a patient that might have diabetes and they have a primary care physician who sees them yearly or in some cases every 6 months or more often, and they're ordering a basic metabolic panel or A1C just to keep tabs on things, but they also see an endocrinologist, and that endocrinologist orders the same tests. You may have somebody go and get blood work twice when they could just go and do it once and have both doctors have access to those results. This creates duplications in services and tests that don't need to be there. With the Impact Act, this allows us to coordinate care, drive the cost down by having them only get the test once and allowing access to everyone involved. The nurse's role in care coordination is to develop care plans that are guided by the patient's needs and preferences. Nurses educate patients and their families with needed information relevant to their care. They also keep in mind the cultural and spiritual diversities and preferences. Probably one of the more important things that nurses do is to facilitate the communication and continuity of care for the patients. This makes sure that all members of that patient's care team are able to communicate fluently with everyone involved. They also advocate for the patient's best interests whenever the patient is not able to for themselves. So here are some of the references and articles that I read to prepare for this. When we look at the first one, continuity of care for people with multi-morbidity, the development of a model of nursing-led care coordination. So this talked about how nursing-led coordination allowed for people who have multiple health issues to streamline their care because the nurse was able to look at the whole picture and be a hub for that patient. The second one was a case study of randomized controlled trials with low-income Latino communities, which talked about the importance of being respectful and cognizant of cultural differences, spiritual differences, and the patient's background with relation to their health care. And the third was the business of integrated care, implementing new models of care in a fee-for-service setting, gave a model for including coordinated care to help drive costs down and keep services attainable for each patient. I hope you found this informative and that it was helpful, and I hope you have a good day.